Welcome to the Business Showcase. I'm Laura Burns with CareerSource Citrus Levy Marion, your host, and today I am joined by two remarkable leaders in our community. We have Alan Kesey. He happens to be the CEO of the Ocala Hospital. I messed that up already. HCA of North and West Florida Ocala Hospital, and also Isaiah Zirkle, who is the HCA West Marion Hospital. And thank you so much for being here.
Thank you. Very happy to be here.
It's been a while since we've done this, so I apologize for the rough start. But before we get into all things HCA, which is quite a few, I have a couple items I want to bring to folks' attention in case you're out there and you want to have a job fair or something like that. We have two I'm just going to mention briefly. First is our annual Heart of HR Conference, and that takes place Tuesday, April 1st, no fooling, April 1st, from 8 a.m. to 4 p.m. at the Circle Square Cultural Center in Ocala. And you know, this is the fourth year we have partnered with our good friends with the Ocala Human Resource Management Association on this conference. So if you suffer from any small bit of FOMO, fear of missing out, you want to be at this conference. If you're an HR professional, a business owner, a hiring manager, anything like that, even if, any public servant, come to this. This year's focus is on driving engagement and innovation, and it's perfect, as I said, for area employers, HR professionals, local decision makers. Happens to be headlined by Johnny C. Taylor Jr. He is the president and CEO of the Society for Human Resource Management, the world's largest HR professional society. So we are excited that he will be kicking off as our keynoter. Now, tickets are still available. We're going to drop a link in the comments section, so don't worry about me giving you the bit.ly address for that. The second thing I want to mention is the 10th annual Marion County Youth Job Fair. And this takes place April 29th from 3:30 to 6 p.m. at the Southeast Livestock Pavilion in Ocala. And it's held as usual in partnership with the Marion County Public Schools and is ideal for 16 to 24-year-olds who are seeking full or part-time employment, and whether it's permanent, temporary, or just for the summer. And for businesses, this is a great opportunity to meet and hire young job seekers who are eager to learn about their own job opportunities, excited to earn a paycheck. I think that's number one, probably should have led with that, but ready to roll up their sleeves and work really hard. So if you're a business out there and this is the demographic that you would like to talk with and meet with, last year I believe we had 250 young people attend this. So if you're interested, please give us a call at 1-800-746-9950 and we can get you hooked up. No charge to participate. And now on to the main event. HCA of North and West Florida, HCA Healthcare, is part of Ocala Health and home to HCA Florida Ocala Hospital, a 323-bed facility in the heart of Ocala, and HCA Florida West Marion Hospital, a 222-bed hospital located in West Marion County, right off of State Road 200 west of I-75. You also have 5 freestanding emergency departments. Wow, that's amazing. Both have just recently announced that they won the 2025 Patient Safety Excellence Awards for the 8th year in a row. And we were talking beforehand, the list of awards and accolades is just incredible. And these are significant because it means quality healthcare, safety, ethics, you name it. So gentlemen, thank you for being here. We really are happy to have you. Who wants to start?
Yeah, I'll jump in. Yeah.
Excellent.
So I appreciate you. Go ahead. Yeah.
Well, Mr. Kesey, you've been here since, I want to say, January 2023, and you had kind of a life-altering introduction, to teamwork and everything, and you brought that to your role as CEO at Ocala Hospital. Tell us a little bit about that.
Yeah, I'll start, I think, with the beginning. First, thanks for having us.
Sure.
I'm very proud to be here, and we're proud to have over 3,200 colleagues, providing that amazing care that you just recognized. It doesn't happen with one, it happens with all and just shout out to the team for achieving that 8 years in a row. I began in healthcare over 25 years ago now. I actually started as a volunteer in a hospital back when I was in college, and so there's no better way to start than when you're 16 years old or 18 years old as a volunteer. And we love our summer teen volunteer program. Just plugging that to start. But my career has taken me through many places with HCA Healthcare, and one of which, as you referenced, was in Nevada. And it's Nevada, not Nevada. I got corrected when I was the COO of Sunrise Hospital Medical Center. And unfortunately, October 1st, 2017, now, it's been, I can't believe that many years ago, many folks lost their lives in a tragic event with a shooting that we'll never forget. And Lord willing will never happen again. But what I saw that night was humanity truly on display. And I think that ethos of we're here no matter what for our community, we're here for one another, and we're going to do anything it takes to save lives and care for folks. And that also includes the mental health as well, because any event like that is incredibly impactful to a community. But proud of that team that night, and I think that ethos and that culture of we're here for the community no matter what is what I've taken with me every day since. And I think I try to bring here to Ocala as well with our team.
Yeah, and you roll from that a few years later into COVID and have that experience as well. So, well, thank you for being here, and thank you for everything you did at Sunrise as well. And that's remarkable. Mr. Zirkle, I know you were the COO of West Marion and Ocala for a while, and then you got appointed in July of 2023, exactly. I think. Tell us about your path.
Yeah, so I've been here in the Ocala market now for 3 years with, as you mentioned, the COO of the 2 campuses and now CEO of West Marion Hospital. Prior to that, I was in California with HCA. I was in Las Vegas with HCA. Served in that community at the same time Alan was there with a short overlap. I was with another company, a few other different states earlier to that. But one thing that we talk about with all of our team members is your why. Why do you do what you do? And so for anybody who might be watching, I encourage you to identify what your why is, and that will guide you along your career path. I think about some of the pivotal experiences that I've had. In 2021, my son was diagnosed with epilepsy, and I ended up spending a month in the hospital. And I've been in the career field for almost a decade, and then now I'm on the other side of it, sleeping in the hospital, hoping that people treat him well and communicate well with him. And that reframed how I look at my career as a healthcare administrator and just the impact that we can have in our communities. And he's doing fine now. But we bring that back to our teams now. Everything we do is to serve this community, and every meeting we have, every building that we build, everything that we do is understanding that might be your loved one that comes into our hospital, might need care, and we want to treat them with compassion and humanity.
Absolutely. And it takes, I'd like to say everyone can be cut out to do what you do in healthcare, but it takes a certain person, with discipline and compassion and the ability to deal with crises that are not that easy to deal with. So thank you for providing that leadership indeed. Let's talk a little bit about the culture of your facilities and your HCA and the hospitals. What is it like to be a part of that, your team?
Yeah, no, Norma, our Vice President of Human Resources, says she's the Chief Fun Officer. And I think that is what we try to bring to our teams in supporting them, because they do have critical roles and they're providing care to patients that are in very critical positions and life crises, to your point. And so we try to balance that out a little bit by encouraging them. Rewards and recognition system is really fun. We have millions of points that we give that can be spent on Disney things or whatever. We round a lot. Isaiah rounds almost every day because I see his pictures on Facebook almost every night. But we do that not just to take pictures. We do it to connect, know folks one-on-one. This morning in our daily huddle, I read a letter from one of our employees whose mom passed away in a different state, different place. And what the culture that she described was that even when she was 900 miles away, so many of her team members were touching base with her, calling her, connecting with her, and so was her manager. And so it really is a family. So we try to bring the fun, we try to connect with folks, but we're there to support each other so we can support the community.
Absolutely, absolutely. And when you think about the time that you spend in your workplace, it is your second family, and you hope to have fun and share, you know, if you've got sorrows, that you have that compassion as well.
Yeah.
So tell me a little bit about what it's like at West Marion, which has really grown quite a well. They've both grown quite a bit, definitely.
You bet. So I'm humbled to be there. It's the hospital's just over 22 years old. Understand that when it was built, there were cow pastures all around it, and people said, "Why would we ever build a hospital this far out?" But that is where the growth is, as you said. So I take that very personally. I was talking to someone today who's been there from the start. They said, you know, it was a 70-bed hospital at the start, and it's grown into what it is, a 222-bed hospital. Soon will be 262 beds, continuing to expand. So people talk about their organizations having that family culture, and I really do try to continue that at West Marion because it did start so small. So we try to learn people's names and understand what's going on with their families, what their work struggles are, and our role as administrators is to remove barriers for our teams to be successful so they can provide the best patient care. It reminds me of there's a book called Patients Come Second, and it's kind of a controversial title, but essentially what it's saying is that our employees, it's like being on an airplane. If something happens, gas masks fall, or oxygen masks fall down, they've got to put theirs on first before they can care for other people. And we take that to heart with our employees, that if they don't feel like they're well taken care of, they're never going to be able to care well for the community. So you have barriers every day for sure, and trying to get better every day, but certainly put that employee first culture into place at West Marion and Ocala.
True. And this is absolutely true, that during the recession, the one industry that was sort of recession-proof was healthcare. You did not see cuts there, and it just continues to grow and grow and grow. We have programs, brand new facility, you know, at CF, all over the place. So if you have that certain something and that compassion, and you want to get into a pretty solid career, this could be the one to do. So let's talk a little bit. Now, you talked about culture and what it's like to be part of that family. Let's get down a little bit to brass tacks in terms of benefit. You don't have to, you have such a variety of staff there. But just in general, what are some of the perks, the benefits of working for HCA?
Yeah, so we have 3,200 employees, and I'll start with one high-level one. When you join HCA, we're a 300,000 employee organization, the largest healthcare provider, not only in America, but also in the state of Florida. So you can advance your career when your family wants to maybe move somewhere else in the state or advance to another state. And you can keep your 401k percentage match. You can keep your years of service and your tenure follows you. We also are the largest nursing school in America now because we purchased Galen College of Nursing, where there's very specific benefits if you want to advance your nursing clinical career as well. We have tremendous leadership development opportunities. I think we're both products of that program, where we're going to invest heavily in anyone who wants to learn how to be a leader. And that's not just being a CEO or a COO. It's really starting as a unit supervisor or a shift supervisor. The tremendous leadership development potential for that as well. And then HCA has what I would call the benefit of being a financially stable organization, meaning we've been there for 50 plus years. We're going to be there another 50 plus years. Hospitals are typically institutions in their community, and it's just a wonderful organization to kind of bank your career on. I know nothing but HCA, and I'm very proud to have been there almost 20 years now, working up kind of my way through the system. And so those are some of the intangibles, if you will, of a good career opportunity with the company.
When you asked that, similar to what Alan said, I think the leadership development within the organization, there's truly unlimited career paths that you can take if you want to do supply chain or nursing or IT. At the local level, at a regional level, at the corporate level, those opportunities are out there, and we are very supportive of our teams and advancing their career in whichever way they want that to look like. We meet with them often, at least monthly. Their leaders are meeting with them and talking about, hey, how is it going for you, and what do you want your career to look like, so that they can maximize their potential, not feel like they're ever stuck in a certain area.
And if I could just ask one thing, Laura, just like tangibly, locally, we have many sign-on bonuses for jobs. We have over 300 open positions right now. And that ranges from everything from clerks and unit secretaries to nurses to food service professionals that are ServSafe certified. I mean, there's really the gamut. I always say we're like a small city. We have to have plumbers, engineers, electricians, food service professionals, janitorial professionals, all the way up to physicians. So we take all of that to provide great care. So a lot of immediate benefits and immediate job opportunities right here.
And too many to list, to name them all. We try to do that, but it's like, wow, because you guys are always hiring, you're always adding. But like you say, everything from soup to nuts, not to be nuts, but I mean, accountants and communications and the healthcare providers and everything. So it's not, if you're thinking, oh, well, I'm not a doctor, I'm not a nurse, I don't have that skill set. There's so much more that you can jump in on and check out. So we'll be sure and provide the link to where people can check that out. I know that we have several posted on Employ Florida, so we provide that information as well. So there's no reason not to be able to take a look and explore the career opportunities that you can have. So that's definitely something to think about. You were saying something that I wanted to follow up on in terms of, we talked about your corporate culture, we talked about the lovely benefits, but another part of who you are is how you are integrated into the community and you give back to the community. Talk to us a little bit about that.
I love being a community leader, as I know Isaiah does as well. And so we always love to not only give back through our dollars, but also really our time. And we encourage that culture of service amongst our leadership team and the whole organization. So one example is, at least once or twice a year, we all get together, we put on t-shirts, we love the logo, we show up, and we go to different agencies in the community. When I first moved here, we went to Tuscaloosa Park, and Caitlin had me on my knees painting curbs with the yellow paint. Hopefully it's still there, but we love serving like that. We picked up all the trash in the park. We went to Interfaith last year and stuffed all the bags for the kids that struggle to get a meal at home. And we just love giving back. I serve as the chair of the United Way. This past year, we gave over $100,000 to 10 children's charities to ensure that kids who are in domestic abuse situations have access to appropriate follow-up care, to mothers and children in those situations trying to get a better life. So we love giving back, and we bring that ethos and encourage that, and I know Isaiah does as well.
Yeah, that social capital is priceless, definitely.
Yeah, and I would just say we live in the community, we are part of the community, very involved in our church. I was the chair of the American Heart Walk, Marion County Walk this year. Our chief nurse at West Marion is now chairing in 2025, trying to get people involved. And so we recognize that it's not just 9-to-5 job, you go home, but recognizing that we are part of the community and we need to give back, and that's a key part of what we do.
And I think that's a key part of what attracts really quality staff to your organization, because like-minded people who care are caring people, or caring people are people who care for people. That's a Jeremy Williams from Chick-fil-A, but it applies definitely. So, before we wrap up, if you have any special programs or trainings, did I hear you talking about like a scholarship type thing, or
Well, here in Marion County and really counties all around us, Levy, Citrus, Sumter, we have various scholarship programs too. Not only have Take Stock in Children's, which I'm a mentor program, but we also have direct scholarships for HOSA students in high school that would absolutely pay for their certifications and help them advance that over time. And we're excited to have those opportunities and really support that. We love having hosted students in our hospital to do trainings and things like that.
Excellent, excellent. Well, anything else that we have not covered that you would like? Yes,
I would
please.
just say tonight, at Crazy Cucumber, from 5 to 7 p.m., we have a hiring event. So anybody who is looking for a job, come by. Even if you don't see it posted on our website, happy to initiate a conversation with you and find you a home. So come by tonight, Crazy Cucumber, 5 to 7.
And they have really great tableside guacamole.
That's right.
If I recall.
That's why most people come.
Wonderful. Well, thank you. We'll also drop that in the comment section. Do we have any? We have some questions.
Yes.
All right.
Our first question is, how can someone make a good impression in an interview?
Oh,
That's a great question. I think, how can someone make a great impression in an interview? I think one is to come with your full self and be genuine. I really think that folks, we really want team members that are going to care for others like family. So as you bring your whole person of your why, as Isaiah was saying, to that interview, it'll come across as genuine and compassionate. So that compassion is what we want to see. We can train technical things, we can train, basics, but we really want to see why you want to care for our community as much as we do. So I think that'd be the best way to stand out in an interview.
excellent.
Okay, and then we've got one more question. What would you say is the #1 quality you look for in non-clinical staff applying for jobs with the HCA team?
Good.
I mean, I think it's the same as the clinical staff. It's understanding why you're doing what you're doing, and that, and that's for our patients in our community. So even the non-clinical staff, we've heard people say, well, I'm just a housekeeper at the hospital. You're not just a housekeeper. You are a housekeeper. You are going in and cleaning rooms for our patients who are sitting there looking at the floor, the wall, or the ceiling all day. That's so important. So people coming in with the passion, that they have, that needs to shine through. And then being able to connect with patients, connect with people in the elevator, connect with other team members is so key. Like Alan said, communication is key. And then just that drive and passion is what we want to see. Like he said, technical piece can be taught. We can teach you how to clean a room. But it's the soft skills, the communication, the listening, the smiling, talking to people, looking at them in the eye, that are things that we look for.
Excellent, excellent. I'm going to just add one little extra thing. If you say, boy, I really want to work for these guys, but I have been out of work for a while, or my skills aren't where I want them to be, or I haven't put together a resume, or don't know the first thing about the job interview, please come and see us at CareerSource Citrus Levy Marion. We have certified career counselors who can work with you one-on-one to develop that resume, to help you with your interview skills, to make sure that when you meet with anyone, you're going to put your best foot forward and know all those pieces. And these are free services. Give us a call at 1-800-434-JOBS, that's 5627, and we can get you all set up. We have centers in Citrus County, Levy County, obviously here in Marion County, so we are happy to help you in any way, whether it's to get a job with these guys, go to the Crazy Cucumber tonight, or maybe down the road you say, I want to pursue it, I can't go to the place with the guacamole tonight, but we're here for that. So definitely give us a call or check us out on our website, CareerSourceCLM.com. Gentlemen, anything else?
No, just pleasure to be here, and thank you for that.
We're so happy to have you. Oh, we have one more question.
Not one question, but a very lovely shout out. I love West Marion Hospital. They truly exemplify the way healthcare services should be delivered everywhere.
Wow.
Thank you. We love you too.
Wow. Excellent. Very good. Thank you so much. Thank you for helping us baptize, christen it's been since August since we've done this, and we're first time here in a long time. So thank you for helping us get back on the saddle, and I hope you have a wonderful rest of your day, and the weekend is almost here. So for the Business Showcase, until next time, I've been Laura Burns here with Alan Kesey and Isaiah Zirkle, and thank you, and we'll see you later.
Thank you so much.